to this very short webinar on pressure care management. My name's Mike Rich. I work for Chief Executive of Barnet Carers, and what we're trying to do at the moment in these, let's call them interesting times, is try and get some of the training that we would normally have on at our carer centre online via webinars. These we, as an organisation, we do support and work with carers, but we also provide a whole range of domiciliary care services as well. And these training modules, which are based on our NVQ, CFQ accreditation and accredited courses, are effectively being changed in order to make them more appropriate for you guys in a home care setting, so for caring for somebody at home rather than on a professional basis. So these webinars take about 35 minutes at the most. They're not quite as interactive as if you were doing the course with us in our office, but needs must at the moment, as I'm sure you'll appreciate. So hopefully what we'll be able to do over the course of the next half hour is give you a sort of like an idea about sort of like what pressure sores are, or pressure care, what pressure care management is, how to recognise some of the different issues, and how to look at ameliorate or managing those issues if you're caring for somebody at home who may be, for instance, bedbound, where pressure sores can be an issue. So that's the background here. What I would say is don't worry about taking notes or anything like that. We'll be putting this onto a website. We'll also be emailing out the slides and a recording of this as well. So hopefully that will give you an idea of something you can take away anyway, and refer back to at a later stage. So without further ado, because it's a webinar, I don't have to do all of the sort of slightly complex things like telling you where the toilets are, telling you that there's no planned fire drills. You're in your own home probably, so you know all of those things. We'll move on. So basically the aim of today is to provide you with some information on the cause, the prevention and care of pressure areas. There's a few learning outcomes. It's an NVQ type based course, so we always want to be clear about what we're trying to learn, even over a half an hour period. And this is what we'll be doing, is listing the causes of pressure areas, those places where you might develop an abrasion or a sore. Describe the process of skin assessment, list the classifications of skin ulcers, so you can get, because they differ, and it's important to know how they're classified. I think either if you're caring for somebody at home, or indeed if you've got home carers coming in, so you have some understanding. Explain a little bit about the treatment and prevention of those pressure areas, and then a little bit about person-centered care. Less on this because you're caring for somebody at home, and that you're fundamentally working in a person-centered environment. So what we want to do first off is look at the function of the skin. What's the skin? What does it do? It's got a few basic functions. First and foremost, if you've got healthy skin, it protects your body. As we all know, it provides a fairly strong and flexible outer layer to the rest of us, holds us all in, I suppose. It regulates the body temperature. We all know about how the skin sweats, and that helps us regulate the body whole body temperature. Synthesizes vitamin D, which is important. It's involved in the production of melanin, I should say, which for those of you, which is involved in how we go to sleep as much as anything else. It provides a barrier for infection and water. Those of you who have done our infection control course said, yes, infection can come via the skin, but that tends to be in a broken skin. So actually what the skin does, if it's healthy, provides a barrier to infection. And of course, we all know it provides a barrier to water. It detects pain and external pressure where your nerve endings are in the skin. That's where you feel the pain. And it's incredibly important that we feel pain, so that we know that something's going wrong and we can do something about it. It allows the removal of waste products, but one of the problems is if damaged, all of these functions can be disrupted, and they can cause us some real problems, and that's what we're looking at. So I'm just going to move myself here. Don't want myself in the way. So get up here. So what is a pressure area? We're talking about pressure care. What is a pressure area? So pressure areas are caused when the skin and the underlying tissue, so the tissue under the skin, are compressed, squeezed for a period of time, and between the bone and the surface on which the individual is sitting on a line. So if you think about it, if you have your hand on a hard surface for a period of time, you can feel as you push like that, you can feel the bone in there, and that's obviously a pressure area there, if I'm indicating that. And that's sort of and that's how we define a pressure area. So an area where the skin, the underlying tissues, are compressed for a period of time between the bone and the surface on which you are sitting or lying, or which is pressing on you. And these have got some significant things we need to think about. Firstly, that means that the blood can't circulate, because and that causes a lack of oxygen and nutrients to the tissue cells, which they need to be healthy. And depending on where the pressure area is the lymphatic system is unable to function properly, and that can be problematic in terms of removing waste products. So key, of course, is who's at risk of getting a pressure area. And you'll notice we don't really say pressure sores now. We call them pressure areas, because that enables us to look at things in a range of different ways. Those people who have problems moving, cannot change positions by themselves without help. So those people who may, pardon me, maybe bedbound, maybe stuck in bed, or maybe in a wheelchair, can't move. There's a whole range of reasons why you might not be able to change position. Those people who can't feel pain over part or all of their body, so they don't realise because they can't feel pain, that there's a pressure area there, or something, a problem's building up. Those people who are incontinent, so that gives you sort of like some extra problems in terms of, obviously fluid, feces or urine, things like that that can cause pressure areas. Or those who are seriously ill, and those, of course, undergoing surgery. So there's some of the people at risk. On top of that, if you've had pressure ulcers in the past, that makes you more at risk. If you've got a poor diet, and this is a really important thing, if those individuals don't drink enough water, they're at risk. Again, if you're very old or very young, you're more at risk of pressure areas. If you've damaged your spinal cord and can't move or feel your bottom or your legs, and again, this is a little bit about cannot feel pain over your body. If you can't feel it, you don't know that you're having a problem, or you've got a pressure area there. And older people who are ill have suffered an injury, and in particular things like a broken hip. So they're the individuals that are at risk. So I just want to talk a little bit, because this is really important, and this is really something that we can look at. Talk about the effects of poor nutrition and hydration in terms of pressure areas. I mean, the effect of poor nutrition is fairly high. What it leads to is reduced muscle and tissue mass. If you think about what we were talking about there, with the pressure between the skin and the bone and the tissue under that, of course, if there's reduced tissue, then you've got less, I suppose, sponginess, you've got less cushion. The effect of poor nutrition is that it gives you, by and large, you have decreased mobility. decrease stamina. It can cause breathing difficulties, and make you an increased risk of chest infection or respiratory failure. And that's really important at the moment, obviously, because of the and worries that we have over sort of COVID-19, the coronavirus, which feels as though it sounds as though it is a respiratory virus. We know that if you've got poor nutrition, wounds that you may have take longer to heal. And if you are ill, it takes longer for you to recover from that illness. You are more likely to have a slower immune response, which increases the risk of you getting infections, and that means it takes longer for you to actually recover from that infection as well. And last but not least, you have a difficulty staying warm as you have less muscle, you have less tissue mass. That increases your risk of hypothermia, and your ability to maintain that sort of like normal body temperature. So, what we look at in terms of poor nutrition, if somebody's, it can be particularly significant, for instance, if you've got somebody with a BMI of less than sort of 18.5, whether you've seen a sort of not intentional and unintentional weight loss of greater than sort of 10% of their body mass over 3 to 6 months. And there are also sort of risks of poor nutrition. We know that people who have just been discharged from hospital, elderly people who are not don't have a balanced diet, sometimes those with cancer or other long-term conditions, those people who have sort of, again, with a balanced diet, excess of some food, so fats and sugars, and again, these are really important. The other thing on top of nutrition is dehydration. And dehydration is it's a major cause of hospitalization, certainly for older people. And it's really important. And, often we find that dehydration with the people we work with, the effects of dehydration are often confused with other things. And if you look at the list we have here, the effects of dehydration, you can understand why. So, yes, they cause headaches. That was one of the the obvious ones. Tiredness as well, a loss of concentration, confusion, which is a lower mental performance. We often say to people who come to us and say, "Oh, I'm worried that my mother's, forgetful. Is she starting to develop dementia?" Well, actually, sometimes, some of this confusion can be really just down to dehydration. It also makes people prone to falls. It makes people prone to urinary tract infections, which can be quite serious, especially in the elderly. It leads to poor kidney function, which can increase the risks of kidney stones, which are incredibly painful, and to be avoided if possible. It can lead to poor liver function, and it can also lead to constipation. And all of those things are, can be really quite serious, especially in older people and younger people as well. So hydration is really a key thing. If you're caring for somebody at home, you should really be trying to make sure that they're drinking 6 to 8 medium glasses a day of water. Not all in one go. Let's top it up throughout the day. Just keep that regular topping up and making sure that the person you're caring for is well hydrated, because it's absolutely an essential part of our diets. Water doesn't contain any nutrients in itself, but it does aid the digestive system, and it's really essential for the promotion of sort of good health and well-being. So just to move on a little bit from that, and as I said, you cannot sort of get away from the importance of nutrition and hydration. And one of the things we would say is, really, if you're thinking about sort of pressure care management, one of the things you want to really look at in terms of risk assessments and things like that is is the person you're caring for well nourished? Are they well hydrated? Are we doing what we can to make sure that they are both of those things? So let's have a look at some of what we call an intrinsic and extrinsic factors. Don't worry about that too much. But so what causes pressure areas? As I've said, malnutrition, poor healing ability. If you can't heal in the same way if you're malnourished. Dehydration, so that reduces blood volume and that interferes with your circulation, and that is going to cause some pressure areas. Obviously, immobility, one of the obvious ones. This gives you areas of constant pressure. If you're sitting and lying or in one place, then that's something where you're going to have pressure areas. Age, over 65s are just more prone to pressure areas. And I think when you're looking after somebody, if you're looking after somebody who's over 65, especially into their 70s and their 80s, and if they've got some of these other things, then you are looking at sort of a situation where people are more prone to pressure areas. And of course, some medical conditions as well. So just looking at some of the what we call extrinsic factors in terms of causing pressure areas. We spoke about pressure before. Then there's shear, and shear is where effectively you are your skin is not moving, but your bones might be, and the tissue in your body is moving, but the skin is essentially staying the same. That's what shear is. Then friction, I think that's a pretty obvious one. Friction is when you've got that sort of movement. So your skin is actually moving against something, and that gives you some friction. Then moisture. So if things are wet or moist, then that can itself cause some pressure areas. And of course, what you have quite more often than not is a whole combination of these, or one or two of them. And if you can see in the illustration, there is just some sort of areas where you might get those green spots on that illustration, and those areas where you might get any number of these, and which will cause those pressure areas. So it's important to actually think about where they might be. Just to talk a little bit about pressure. So this is where the body weight compresses the skin and the tissue and damages the blood supply to an area of skin. So you've got some illustrations on the left-hand side of somebody lying down, one on their side, one on their front, one on their back, and you can see where those pressure areas might be. They're pretty obvious to most of us, because actually if you think about it and you lie down, you know where you touch, and you know where that potentially if you were lying there for too long, you might have a problem. And you can see, some of those in terms of the individual in the wheelchair, the individual who's standing here, but that's really an illustration of their back if they'd have been lying down, where all of those parts might be in contact with, a chair or a wheelchair or indeed a bed. As I said, shearing, as I've said before, that's a damage when the body tries to move, so the surface of the skin stays on the support surface. So the body's moving, the skin's not. The skin is staying on where attached to the chair or on the chair. Friction, said as shearing, but the skin does move, so it actually moves. You've got that friction there, yeah. And this, if you're using when you're moving, handling people, especially those who are difficult to move, sometimes poor handling techniques can cause friction. We do another course on manual handling, which tends to and we'll be putting some of that. We're trying to put that together to see how it works as a webinar, and hopefully we'll get something like that out to you in the next weeks. But it's a little bit more complicated doing it as a webinar, I have to say. So some of the extrinsic factors: poor drying after washing, damp hands or damp parts of the body, sweat, where somebody's been in bed, might have been sweating, that's going to cause a few problems. Drainage from wounds, incontinence we've spoken about. You might have urine and feces, and that can contribute to sort of breakdown in the skin. Changing balance of the pH balance, the acidity of your skin, the sort of changing the makeup of your skin can be a problem. And then, of course, you can have sort of bacterial action. You might have some sort of like bacteria on the skin that can cause some problems here as well. just a little bit on moisture there. You said moisture can increase skin friction and it can weaken the outer layer of the skin if you're exposed to moisture for a long time. And one of the things here is washing with soap removes the sebum, which is the skin's natural protection against moisture. So one of the things you need to think about is emollient. I think for lots of us at the moment, we can relate to this because we're washing our hands more than we've ever washed them before because of the coronavirus. And I'm sure most of you are saying, actually, you know what? Soap and water is great, cleans the hands, but by golly, it makes your hands sore. And that's a really clear indication. So moving on from that, we're going to talk a little bit about prevention and management, and really about monitoring pressure areas, assessing pressure areas. We're going to talk about a little bit about the grades of pressure area, from 1, I think, through to 4, and look at a little bit about specialist equipment, although not a great deal on that, a bit about treatment, and a bit about how you monitor them. So one of the things I think is useful to know, even in the home situation, is how things are looked at. And I think this might not be entirely relevant to you, but you might have home care workers working with you or working with the person you care for, and I think it all helps to understand these things. So just very quickly, pressure care is effectively assessed on what we call the Waterlow assessment. So there's a Waterlow score. It's a very popular tool, certainly used across the UK and certainly in the NHS. And that effectively assesses the risk of a person from pressure sores. So we've got sort of under 10 here is classed at high at risk. Over 10, I should say, is classed as at risk. Over 15 is classed at high risk, and over 20 is classed at very high risk. And one of the things your home care staff might do, a district nurse might do, is reassess the person you're caring for based on this Waterlow assessment. So the whole point of the Waterlow assessment is to look at a number of things. Firstly, is to look at the cause of that pressure area. What's the underlying cause of that? To look at the location. Where is that pressure area? To look at the size of it. Is it small? Is it large? There's a grade. And we'll look at that in a minute. They looks at the pain factor. So for the individual, how painful is the pressure area. They look at the appearance. They look at discharge that might be coming from the pressure area, the wound. Look at the sign of infection, and they look at the smell that's coming from the pressure area as well. And then what happens is the pressure areas are classified. So you have a sort of grade 1 classification. So you can see here, I'm not entirely sure whether that is an elbow or the bottom of the foot. I think it's the bottom of the foot. But what you have really is a redness, but of intact skin. So you've got some discoloration of the skin. You might have some warmth when you've touched that. Edema, which is swelling, which is caused by a retention of water. You may have some hardness, and you might have some sort of blueness or purpleness, especially on those individuals with darker skin. And that's what we regard as a grade 1 pressure area. In grade 2, you've got some some of the skin thickness has been lost, and that may mean that you've lost some of your layers of skin involving the epidermis or the dermis. You might have an ulcer, but it might be superficial, and might just come across as an abrasion, or it might come across as a blister. And we all know sort of blisters from going out walking too far, so we all know what they look like. And then the outside of the skin surrounding that pressure area might be sort of like reddish or purple, and that's a grade 2 classification. With grade 3, and you can see by now that what we're looking at is getting slowly a little bit more serious and certainly looking a lot more painful. And you can see from not only the photograph but the illustration on the right hand side what the sort of the difference in depth of this particular pressure area. So you've got full thickness skin loss. So this is where, you know, fundamentally you've got most of your skin has been damaged. And that could go through down into the flesh under the skin, and that gives you it doesn't necessarily have to, but that gives you a grade 3 pressure area. And you have grade 4. As you can see, this is really from the photograph and from the illustration. This can be look and feel, and you can imagine it can be really quite nasty. So this has got full thickness skin loss, and this has involved damage or necrosis. That's effectively death of your subcutaneous tissue. That's a tissue under the skin, and that extends down into your flesh. Really difficult to heal. And can be a real issue in terms of infection. So that's your sort of grade 4 pressure care area. So the pressure sore. And, you know, as you can see, as you go up through the grades, they become increasingly more serious, increasingly more painful, and increasingly difficult to deal with. So just to look very briefly at the complications of the pressure areas. So cellulitis. Now, can't say that in a hurry. Cellulitis is an infection that can spread from the site of a pressure ulcer to the deeper layer of skin. And this can, you know, symptoms can cause pain, redness, swelling of the skin. And there's always a risk of infection that can spread to the blood. You may end up with sort of like blood poisoning or sepsis. And that, of course, is exceptionally important to look at. So blood poisoning, again, if you've got a weak immune system, you've got a pressure ulcer that becomes infected, there's always a risk that you end up with sepsis, and that can of course lead to septic shock, and that can be fatal. So it is something that needs immediate treatment in an intensive care unit. And so this is, you know, something that needs dealing with straight away. Also complications, and remember we're talking about complications here. This is not everyday stuff, this is complications. Complications: bone and joint infection, pressure ulcer infection can end up becoming downwards into your joints and bones, pardon me, and that can cause damage to your cartilage and your tissue. And you know, more often than not, you probably would need antibiotics to help supporting that. Necrotizing fasciitis, commonly known as, you'd have heard of this, a sort of flesh-eating bacteria. It's a really serious skin infection. Gas gangrene is rare again, but serious form of infection that can come from pressure ulcers. So just in terms of pressure area treatment, now we've just very briefly talked about some of the real complications of it. I mean, the doctor or nurse will usually arrange appropriate medical treatment if you've got somebody who has pressure areas that need dealing with. And a lot of these pressure areas are relatively standard. So antibiotics, if you've got a pressure ulcer, it may be, in order to prevent that area becoming infected by bacteria, they'll give antibiotics. They might give some antiseptic cream. Often they will be, you know, pain, as you know, can be quite significant with regard to pressure care. And pressure areas. So more often than not, somebody will prescribe you some pain relief. A high protein diet is something that they'll be looking at. Regular repositioning, moving people around, making sure that they're not that you've got people moving so that the pressure is not placed on one area of the skin the whole time. In your case, they might give you some equipment to help move people. and that can be, that can be important as well. I think if you've got really, what we do know is if you've got really serious, the sort of level 3, level 4 types of pressure areas, then there may be some surgery that are necessary, and sometimes they'll use specialist dressings for those. And larva therapy, you may have heard of, is use larvae in that which helps effectively get rid of bad dead skin, and that can be very effective as well. So just in terms of the dressings, these are the types of dressings that your nurse or doctor might make sure you have. So you've got an adhesive dressing that gels over the wound but sticks to the surrounding skin, so you don't have a stickiness on the actual wound. You have hydrogels, which is a simple gel that keeps wounds moist but also can help clean them. And then in some cases we use foams, and these can be different shapes and size foams are designed to absorb and retain fluid if you need them. When you are looking at sort of like planning to sort of help promote healings of sort of pressure areas, there's a few things that people look at, and I think it's always worth knowing about these. So fundamentally, relieving of pressure, trying to get the pressure off those particular areas. Then you get onto positioning, mobilization. That's about moving people, making sure that the pressure areas aren't the same, and people get moved. And I think if depending on the situation at home, you might find that you're moving somebody, turning them in bed, or making sure that they're not in the same position for any long period of time. If you are noticing pressure areas at home, then it's important that you get a professional assessment of these things. So and you do the things that are important to encourage healing. So we talked a bit earlier about sort of, moisture and things like that being problematic. Then it's important to make sure that areas are dry, for instance, that there aren't areas of friction. Talked a little bit about infection control. We do an infection control course as well, but that's really important. Again, something we spoke about earlier, really important: nutrition, making sure that the individual you're caring for has got an adequate nutritional intake and adequate calorie intake, and they're getting the right type of diet as well. Hydration, incredibly important. As we said earlier, 6 to 8 cups of water a day, or small glasses of water a day. You need to keep topping up. It's not just a one hit of your water. It's important that for the skin, that the skin stays, that the individual stays well hydrated. And mobilization. Can you get people moving if you can, because that increases circulation. And this is a little story here about, I suppose, a hero of pressure areas from a nurse in the 1950s who showed that, fundamentally, that actually moving people where she worked every couple of hours had a massive impact on people's pressure ulcers, which at the time, with people staying in hospital for a long time, was a major killer. So actually moving people around has, a really positive impact. It helps relieve pressure on particular areas. It helps promote circulation. It allows, as you can imagine, it allows air to reach the skin in places where it hadn't been. It helps reduce temperature. It helps reduce humidity to the skin. It helps avoid, if you can, it's avoiding incontinence. And if you're moving people, and especially if you're being very carefully about it, it allows the skin to be inspected. A little bit on skin. The slings at the bottom there is not something that we are going to talk about today. If you are using a sling or a hoist at home, undoubtedly you would have been shown how to use it. But it's really important that you get proper training in terms of moving and handling people. So just a little bit on pressure relieving devices. Those, we've got a couple here. So we've got static ones. They're designed to distribute local pressure over a larger body surface, and you'll know about these foam mattresses, devices that can be filled with water or gel or air, so that they've got that. So they're not moving, but they help distribute that local pressure. Then you have dynamic devices, and they can be sort of electrical air pumps that sort of like inflate and deflate cells in mattresses, and that can be sort of like over an alternative pattern. A sort of like an example there of an air fluidized bed, but you may have something that's essentially moves according to a program. One of the things you shouldn't use, well, these are the things you shouldn't use, is effectively water-filled gloves, synthetic sheepskins, genuine sheepskins, or donut-type devices. They do not help in terms of relieving pressure areas. So when you are actually, and one of the things we're going to talk very briefly about, in terms of when you're actually working with somebody who's got sort of pressure areas. These are just some of the things that you need to think. So always be aware of sharp objects, rings, watches, things that, might actually, if you accidentally pulled across somebody's skin, might actually damage their skin if you're assisting them in moving. It's really important, as we said before, that we keep skin hydrated. You don't want it moist, but you want it hydrated, so you use emollients. We spoke very briefly about sort of like, soap and the fact that it dries out the skin. Obviously, at the moment, we're very keen on hand washing, but we do know also that hand washing with soap does dry out the skin. And it's something you need to be very careful of with people with pressure areas. And if you're drying skin with a towel or something else, use a patting motion. So pat, dry, don't rub, because if you think about it, rubbing dry is just going to, causes the friction that we talked about earlier. Don't use talc because, it can get caked together, can also cause some friction. But if necessarily, especially if you have a situation where somebody is sort of like slightly incontinent, you might be able to use barrier products to help with those. We're coming to the end now, and I just wanted to really talk to you very briefly about the management of pressure care and pressure areas, I think. And the importance here is really of just saying this is a multidisciplinary approach. This is not something you can do on your own. If you're managing somebody or you're caring for somebody who's got pressure areas, then you need to be talking to the district nurse. If you've got more serious pressure areas, then you need to be talking to maybe specialist nurses, a physiotherapist, a doctor, a podiatrist if you're looking at the issues around feet. If there's more significant areas, maybe infection control. If the person you're caring for has an issue with incontinence, then find out if your local NHS has got an incontinence advisor and see if you can speak to them to get some more help for that. And of course, we talked a little bit before about nutrition and hydration, and so I think it's really important that actually, if you have got concerns about this, that you speak to a dietitian or somebody like that. Now, that's pretty much the end of the webinar. Hopefully you found it useful. As I said, it's a bit whistle stop. It's 40 minutes from a course that would normally, if we did it with our care staff, last nearly 3 hours, and would be a whole lot more interactive and would have a whole lot more questions and answers. But what we wanted to do is at least give you, as I said, a whistle stop guide to pressure areas and see how you can actively help support people you're caring for at home. So what I would say is, as I said, my name's been Mike, and I would say thank you very much for attending. We will be sending out the slides for this. We will be making this available as a recording as well to those people who haven't been able to make it or only came in halfway through. Look out on our website, which is www.barnettcarers.org, for upcoming courses. And in this day and age where things are, let's say, uncertain and challenging, be safe out there. And if you need our support, please don't hesitate to call us. Thank you very much. Bye-bye.